Regarding HRT, hormone replacement therapy, and cardiovascular risk in women, this is a topic that has been very misunderstood. There was a study, it's now been maybe 15 years since this has been released, that was purported to suggest that women that were taking HRT were at increased risk of cardiovascular disease. That study has now been thoroughly debunked, yet many doctors still worry about this. And some issues with that study were, first of all, the form of HRT that was used. They were using what was actually pretty high dose synthetic hormone replacements. Most modern doctors that are recommending hormone replacement would no longer even consider using that same form. We now tend towards what's called bioidentical, a more natural form, and it's at much, kind of lower doses. And the more modern evidence really suggests that, if anything, HRT is going to be protective from a cardiovascular standpoint, not harmful. And so anyone that's having symptoms related to, we'll call it hormone deficiency, menopause, I think bioidentical HRT is a great option, and you should not be concerned about your cardiovascular risk. And ultimately, right, I would be thinking about the same cardiovascular risk factors that we always talk about. Are you insulin resistant? Do you have inflammation? And whether or not you're on HRT really doesn't end up changing that equation for us in this practice.